Hi, I'm Emma Hanene, and I'm a Knowledge Translation Officer at AFIDEP. I work on IMPALA, which stands for the International Multidisciplinary Program to Address Lung Health and TB in Africa. As a program, it spans 11 countries, including Malawi, and seeks to generate multidisciplinary research that can be put into practice and policy. The purpose of IMPALA is to generate multidisciplinary research that will improve the lung health of Africans. As AFIDEP, our role on the project is to lead the Pathways to Impact component. So this means that we want the research and the evidence that's being generated to actually be translated into policy and practice. In other words, we want the research to matter. One of AFIDEP's roles on IMPALA is to conduct trainings for the different IMPALA researchers. And this training focuses on policy engagement and evidence uptake. That is, how can researchers maximize the impact of their research? So the trainings involve different components of the policy engagement process, developing a policy question, a policy analysis, and then actually how do you pitch your research to policymakers so that they understand the meaning of your research and can actually do something about it. This year's World TB Day is themed It's Time. It's time to end TB. There have been many commitments made at national level, regional, global levels. There have been incredible breakthroughs, drug development, diagnostics, all in an effort to end TB. And yet, we still see that people are dying from TB. Many don't even know their TB status. And many others who do know their TB status can't receive the proper medical treatment to cure themselves of TB. It's time for that to change. Please take a look at my interviews with some leading TB experts in Malawi. Hi, I'm Emma, and I'm here with Phiri and Tromy Harawa from FACT. How are you today?
Very well, thank you so much.
Happy World TB Day.
Happy World TB Day to you.
Thank you.
I almost forgot it's World TB Day, but it's time.
It's time.
Yes.
Please, if you could introduce yourselves and FACT.
Thank you so much. I am Toko, as been introduced. I am with Facilitators of Community Transformation. It's in short called FACT. We are an organization that was established in the year 2012. It established by women who had passion for TB, HIV, and malaria. We exist to promote sustainable development in Malawi by ensuring that women, children, and the youth are accorded their fundamental rights and equitable access to health, education, and agricultural services and other public services through research, networking, capacity building, social mobilization, and advocacy. We are implementing a lot of projects on TB, making sure that all the people in Malawi have access to diagnostics. We find the missing cases and making sure that everyone is treated, but also zeroing in on marginalized populations like prisoners and children. Today, we are going to reflect upon the World TB Day that is coming on 24th of March, knowing that that is a crucial moment for Malawi to make sure that we raise the profile of TB and making sure that everyone responds to the epidemic, knowing that we have got the 2030 goals and that we should make sure that Malawi keeps on track. And thank you so much for having us.
Thank you for being here.
Thank you so much, Toko. I'm Tromy Harawa, and I'm the program manager for health policies and advocacy. And also I'm working with the Facilitators of Community Transformation.
So you mentioned, Toko, prisoners. Is TB among prisoners a big deal? What efforts have been made in Malawi? Can you expand upon that, please?
If we look at the prison conditions in Malawi are an environment that is spreading and necessitating the spread of many diseases. The conditions are not healthy. We have many cases of, overcrowding in prisons, lack of nutritional support. As you may know, that prisoners in Malawi do have only 1 meal in a day. And nutritional conditions also contribute to the development and progression of diseases like TB and MDR TB. As you may recall, in 2017, we had an MDR TB outbreak in 2 prisons of Malawi, that is in Zimba and Maula prison. And following that, we had a discovery of 6 MDR TB cases within the prisons. When that news came to us as civil society organizations, and mainly FACT working on TB, we were very concerned. And we had made sure that we mobilized a lot of stakeholders, including CREA, AIDS and Rights Alliance of Southern Africa, and Southern African AIDS Litigation Center. We came together to look at the issue and say, this is a human rights issue. As a human rights issue, it needed a human rights approach. And as such, we went on to get more partners involved. And of course, AFIDEP was among the partners that were so supportive in the process, making sure that we engaged in policy dialogue. And indeed, we had the interface forum that we convened, where a number of partners were on board to look at the policy challenges that we are facing in Malawi, and one of them being the Prison Act that you if you may, that is so archaic, that was developed a long time ago. It does not take into account of emerging public health issues like TB, and how overcrowding also impacts on the increase in TB cases. After the interface forum, we had a number of discussions. We had the Minister of Health present. We had the members of Parliament present, as well as legislators, to also look at the role that they can play in making sure that we do oversight on the already existing policies and instruments, and how those contribute to reduction of cases. After the interface forum, we discussed a number of things, and through the engagement of the Minister of Health, they also decided to take a responsibility to look at the existing policies, evaluate them, and look at the gaps, and how they can also embrace addressing of the gaps within the existing policies. It followed with a policy validation process, where a number of stakeholders as well were engaged, and we played also a very supportive role in making sure that the policy validation process also encompassed the recommendations of the interface forum. The policy now is with the Principal Secretary of Health to endorse it, and now it becomes a policy that will be used at a national level at all the 30 prisons of Malawi, zeroing in on reducing cases of TB, actually ending TB. As we stand, our focus as FACT is to actually look at the policies and say, we have very good policies, but we should move beyond policy. And it's time to put policy into implementation, put policy into practice, get everyone involved to understand the policies, and that's where we are right now. And we will continue to engage all the partners on this task, to making sure that we have no case of TB within the prisons, because it's a human rights issue. It is indeed time, as we move into the World TB Day, that we remain cognizant of the fact that people are still dying of TB. And this is not the time that we should be talking about missing cases. We understand as an organization that the National TB Program and the Ministry of Health and all other partners are doing their level best, but we can't afford, as a human rights principle, that anyone of a living being should die of a preventable disease like TB.
Thank you so much, Thokozile. And I'm going to talk about TB. Maybe before I start talking about the current issues, I should take you back a bit of what was happening in the past, and what are the initiatives that has taken place so far to reach this time. In terms of the management of TB previously, there are some drug regimens that were approved by the country, that these are the treatment that a child with TB is supposed not to receive. And it was in form of tablets. And tablets, by then it was a problem. Most of the child did not adhere to the drugs because of the tablets were too much for them. And you talk of the bitterness of the drugs, and you talk of also the quantity of the drugs the child is supposed to take at once. It was about 10 tablets at once. So that was a challenge to most of the children to adhere to the treatment. So at the country and the other, policy makers, they had to sit down and to see how best can this problem of adherence can be addressed in Malawi. So it happened that that formulation of drug was changed. So instead of the tablets, it was changed to water. So that's the formulation that we are using currently, where a child is able to get that drug in form of water, which is now inconvenient to children. Now that we have a TB caucus in place, we are sure that some of these problems can be addressed by involving these members of the parliament, because sometimes maybe they need policy issue that members of the parliament can work on that one, and also other partners where we can work together so that we can address these issues. So that's what I can say about Child TB.
Thank you so much for your time and sharing your really wonderful insights about TB in Malawi.
Thank you so much for having us.